Welcome to Integrity Linguistics Institute. Okay, so now I'm going to play you the audio. The audio script.
The aim was really to provide a resource, not for the top-level professional sports people, but for parents, teachers, and coaches of young people playing sport. Mm-hmm. The guidelines basically offer some expert information from a GP, an emergency physician, and myself as a neurosurgeon about what the condition is, also how to identify the symptoms and how to manage it. If any of your listeners have ever had a concussion doing sports, you'll know how frightening it can be. It's confusing and painful and difficult sometimes for teachers, parents, or whoever to work out if someone with concussion is okay. I mean, we hope to remedy that. Mm-hmm.
All right. Now, all right, so what's the answer? Type your answer in the chat box. I'll play the audio once again. Now, let's hear the audio script.
The aim was really to provide a resource, not for the top-level professional sports people, but for parents, teachers, and coaches of young people playing sport. Mm-hmm. The guidelines basically offer some expert information from a GP, an emergency physician, and myself as a neurosurgeon about what the condition is, also how to identify the symptoms and how to manage it. If any of your listeners have ever had a concussion doing sports, you'll know how frightening it can be. It's confusing and painful and difficult sometimes for teachers, parents, or whoever to work out if someone with concussion is okay. I mean, we hope to remedy that. Mm-hmm.
All right. All right. Now, so this is a medium difficulty question. It is not too easy, and at the same time, it is not too difficult as well. All right, it is not too easy, but not too difficult. But over here, you definitely need to bring in your elimination skills. Again, comprehension, retention, detection. And one answer option can be very easily eliminated. One answer option can be eliminated towards the end. And one answer option can be suspected as the correct answer if you give importance to the keywords. Right, so now let's talk about the strategies over here. All right, so this is an interview. Okay, so interview basically means you will be hearing two people speaking. Right, so it is an interview between a neurosurgeon. Okay, the surgeon's name is Dr. Ian Marsh. Right, and this person is being interviewed. Okay, and this person is specializing the treatment of concussion in sport. So concussion again, every one of you over here are medical professionals. So concussion basically means a head injury. Okay, that is, getting injured in the head, and because of that, having certain complications. That is what concussion is. All right, so you need to have that vocabulary knowledge over here. Now, the first question over here is this. Dr. Marsh, okay, so this is the main speaker over here, says that one aim of the new guidelines on concussion is, okay, so we have the disease condition. The name of the disease condition is concussion, and there are certain guidelines, and these are very recent. Okay, these are very new guidelines. Now they are asking you what is the purpose of these new guidelines. Okay, so a lot of changes happened. That is, there were past guidelines, there were old guidelines, and now they have rejected all the old guidelines, and now they have made some new guidelines. And your duty over here is to identify why these new guidelines about concussion was made. Okay, the reason why it was made. So what is answer option A, B, and C? Answer option A, B, and C are all reasons, okay, or all are aims. Okay, these are all aims over here, aims of this particular concussion. A, B, and C, they're all aims. So why this concussion was made in the first place? Okay, that means the guidelines. The aim of the guidelines. Right. Now let's do the comprehension. Comprehension is nothing but understanding the question, and for that you need to do the keyword analysis. So what is the first aim over here? The first aim of the guideline was to educate young sports people in how to avoid getting it. Now see over here, before I go any further, we have a lot of it over here. What does the word it mean? What does this word it refer to? Type
About
it.
concussion.
Sorry?
Concussions?
Yes, very good, right? So it over here is referring to concussions, okay? It is not referring to guidelines. Okay, so over here, you have to make that connection. So there, the aim of the guidelines was to educate. So educate basically means what? To provide awareness, to give knowledge. And who's the target audience over here? Young sports people. Okay, so the people who are playing sports and they're very young in how to avoid getting concussion. That is how when they're playing sports, how to avoid getting a sports injury or that is, head injury. Right. So that is the keyword analysis over there. Now let's take a look into the B option over here. 1 second. Yeah. So B option over here is the aim of the guidelines was to correct some common misunderstandings about concussion. So when it comes to concussion, people have some misunderstandings. All right. And these misunderstandings are being rectified or corrected. Okay. So the guidelines was prepared because there was a lot of wrong information. There was a lot of misinformation. So the aim of the guideline was to rectify those misunderstandings. Okay. That is to give the correct information to everyone. Okay, to correct the wrong information. Right. So that was the main aim over here. What is answer option C? C is telling the aim of the guidelines was to provide a range of specialist advice about it. Now, range basically means what? Range means a wide variety. Range. Okay, so that is what we call as a range. That means it is an to a certain degree. Okay, so there is a wide range of specialist advice about concussion. Okay, so specialist means it is not ordinary advice. The advices are not coming from ordinary people. The advices are coming from, medical professionals who are specialists in the field. Okay, and these specialist advice, okay, these specialist advice are being provided to the general public through the new guidelines. Okay, so again, you need to comprehend the question like this. Again, this is the foundation. Now, there are some students who may be thinking like on my examination day, how will I be able to understand all this in that small period of time? I have to say that this is the foundation that you have to build. Okay, building the foundation is a very slow process, right? But without that foundation, nothing, no matter how much you build up, it will completely collapse. Right. So build the foundation. That is the comprehension skill you need to develop. Maybe you need to spend maybe 1 or 2, 3 days only in the comprehension aspect. And once you have built the foundation, then slowly, you will be able to do it everything in the stipulated time in a very short period of time over here. So now let's do the verb analysis. Now let me give you an idea on how to quickly. Okay, so again, when it comes to time management, there are some small tips I can give you, right? So the strategy over here is to first of all identify, my duty over here is to identify the aim for why these guidelines was basically made, right? So over here, you bring in the verb analysis. Verb analysis basically means identifying the actions over here, identifying the verbs over here, because usually the verbs are the focus of the answer options. So what is the verb over here? Educating, right? Educating is an action, right? So that is the verb. So to educate young people. Okay, again, those are the keywords. So the aim over here, the aim of the guidelines was to provide education to young people on how to avoid getting it. That is prevention of it, prevention of concussion. That is the aim over here. What is the verb in answer option B? Correcting some misunderstandings. Okay, so over here, this is the verb over here, right? So the main aim is to correct some misunderstandings or wrong information about concussion. Right. Now, what is the verb in answer option C? To provide a range of specialist advice. So over here, providing and to provide, again, what are they providing over here? They are giving specialist advice. Okay, so provision of specialist advice is basically the aim for these particular guidelines. Now you see over here, now it becomes a little bit more smaller. Now it will not take you too much time. Okay, that is as soon as you get the question, okay, my duty over here is to identify the one single aim for these new guidelines. Okay, is it to educate young people on preventing it? to correct misunderstandings, and to provide specialist advice. Now you see over here, now it becomes a little bit more easier, right? That is, in a very short period of time itself, you're able to register the core message into your mind. So this is what we call as the verb analysis. Okay, so I'll just type down over here. This is what we call as the verb analysis. And this is for especially for those who are very much concerned about the time management. Again, don't put yourself in a hurry because your mind needs to be very calm for you to decode the correct information. Right. So now you have comprehended the question. Now you're about to listen to the audio. So when you are going to listen to the audio, once you have comprehended the question, now it is retention. Okay, now you have to retain all this information to your mind. Now, when the audio is playing, your eyesight should only be in the answer options, right? When the audio is playing, your eyesight should not go into the question. The memory of the question should be here. Okay, so I'm listening to Dr. Marsh talking about new guidelines on concussion, and my duty as a candidate over here is to identify the aim for these new guidelines. So the aim is to educate young people. The aim is to correct misunderstandings. The aim is to provide specialist advice. So now your eyesight should only be in the answer options. Right. And that is how you have to listen to the audio. Because if you distract yourself by reading the question when the audio is playing, it is not going to be a very pleasant outcome. Right. So now let's take a look into the audio script over here. Right. So yeah. So here, this is the audio script. Let me just elongate this up. Okay. All right. So let's see what the audio script is saying. So the interviewer is saying, my guest today is Dr. Ian Marsh. He's a specialist. He's a specialist in the treatment of concussion, that is in sports, and a co-author in a new set of guidelines. Okay, so this person over here, he was the co-author. So this particular person, he is the person who wrote these guidelines, this new set of guidelines. Now see the trigger response. So in yesterday's class, I told you, right? If there are two speakers, the main speaker will give the main message, but the other speaker will give the trigger response that shapes the conversation. So here the person is asking a question which is going to shape the conversation. So Dr. Marsh, what's the aim of these new guidelines? Now see that directly they're asking, what is the aim of these new guidelines? Right. So now the person is directly beginning with the main speaker over here is directly beginning with the aim. So we listen to the audio 2 times. Now let's read the audio script. Now the person is saying, well, the aim, okay, so see, that is the main keyword over here, right? So let's find out. So let's have a very curious mind. The aim was really to provide a resource, not for the top level professional sports people. Now see over here, in the very beginning also saying, the aim of these guidelines was to provide a resource, okay, but for whom? Okay, it was not for the top level professional sports people, but for parents, teachers, and coaches of young people playing sport. Now you see over here, who is the target audience? The target audience is basically not the people who are playing sports, right? See, it is not for the professionals who are playing these sports. But these guidelines over here, the new guidelines over here, they have been prepared. Okay, the aim was to give the parents, the teachers, and coaches of young people playing the sport over here. So these are the target audience, and these are the people for whom the guidelines have been mentioned. Now, what is answer option A telling? Answer option A is telling to educate. Answer option A is telling to educate young sports people in how to avoid getting it. Now, in answer option A, who is the target audience? The target audience is young sports people. And the verb over here is to educate the young sports people in how to avoid getting it. So it doesn't matter. Okay. So even though education is not mentioned or prevention is not mentioned, okay, the target audience in option A is young sports people. But what did we hear from Dr. Ian Marsh? He is saying the guidelines are for parents, teachers, and coaches for the sports people, right? And it is not for the people who are playing these sports. So it is direct contradiction. Okay. The aim, that is the statement from the order script, is in direct contradiction. That is, it is directly opposite to what is mentioned in answer option A. Right. So for this reason, immediately you can eliminate answer option A. That is, as soon as you hear the very first sentence, answer option A is eliminated, because answer option A is telling the aim of these guidelines is to educate young sports people in how to avoid getting concussion. But Dr. Ian Marsh over here, he is saying that the reason why these guidelines was made was to provide a resource not for the top level professional sports, but for the parents, teachers, and coaches of young people. So what you have done, you have eliminated answer option A, right? So now you are left with either answer option B or C. Now you have 50-50 chance. That is either B option or it is C option, right? So now let's come to the audio script once again. Right. So here the audio script is saying the guideline. Now see over here, the keyword is guidelines. Okay, not concussion. Aim of the guidelines. So when you hear the guidelines, you have to become very, very alert. Right. So the guidelines basically offer some expert information. So what is the guidelines doing over here? The guidelines are offering something. And what are they offering? Expert information. Okay. Expert information from GP, an emergency physician. Physician means doctor. Emergency physician means, who is in the casualty department, and myself. And who is he? He is a neurosurgeon. Right. So expert information from GP, emergency physician, and a neurosurgeon about what the condition is. Condition, that is concussion, and also how to identify the symptoms and how to manage it. Okay, so this guideline. So what do we understand from this particular sentence over here? From the second sentence, we understand that this guidelines was prepared for parents, teachers, and coaches of young people playing these sports. And this guidelines, the information is coming from, it is expert information. It is not ordinary information. It is expert information coming from general practitioners, emergency physician, and a neurosurgeon about what concussion is, how to identify the symptoms, and how to manage it. Now, what is answer option C telling? Answer option C is telling the aim is to provide a range of specialist advice. Okay, so is, over here. Okay, so what is the keyword over here? The keyword over here is range of specialist advice. Now, is that mentioned? Is specialist advice mentioned? Now, see over here, specialist advice is definitely mentioned, right? See, it is specialist advice, that is expert information, and it is coming from different ranges. It is coming from GP, number one. It is coming from emergency physician, number two, and from a neurosurgeon, number three. Okay, and about how to identify the symptoms and how to manage the symptoms. Right. So that is exactly what answer option C is telling, to provide a range of specialist advice. That is the aim of this particular guidelines. So what have we done? We have first and foremost eliminated answer option A, and now your eyesight. Okay, see, offer, again, provide is also mentioned, offering is mentioned, right? Offer, provide basically are synonyms. So now you can say that answer option C could be the right answer, because provision is providing, offering is mentioned, a range of specialist advice is mentioned, and everything is about concussion. Right. So you can strongly suspect that C could be the correct answer. All right. Now, what is answer option B telling? B is telling to correct some common misunderstandings about it. That means there are a lot of rumors, there are a lot of gossips, there is a lot of misinformation or wrong information about concussion, and the reason for these guidelines was to clarify or rectify or correct those misunderstandings. Right. Now, let me see if that is mentioned anywhere or not, and how to manage it. And here they're telling, if any of your listeners have ever had a concussion doing sports, you will know how frightening it can be. Now he's saying, okay, now he's asking, now he's speaking to the listeners. Now he's telling, okay, if you ever had, if so, that is when, as a listener, if you have ever played sports and if you have ever had a head injury or a concussion, you know how frightening it can be. Okay, it basically means concussion. Okay, and he's also saying it is confusing and it is painful and it is very difficult sometimes for teachers. Now, see, now he's reinforcing the idea. So, see, when young people are playing, and if they get a head injury, it is, even though the people are not suffering the head injury, the victims, the teachers of the victims, the parents of the victims, or they are also in a very painful and difficult situation. Right. So that is the main reason why this guideline was mentioned. Or whoever to work out if someone is concussion is okay. We hope to remedy that. Now see over here, there is absolutely nothing mentioned about misunderstandings. Is there anything? Is there any information about common misunderstandings or rumors or wrong information? And is there anything mentioned about clarification provided regarding that? Nothing is mentioned. There is absolutely nothing is mentioned. So B is very easy to eliminate. B is eliminated because why? No information regarding misunderstandings and corrections are mentioned. So if it is not mentioned, that cannot be the right answer. Right. Now over here, this is your duty. Now what is answer option A telling? Answer option A is telling to educate young sports people. But in the answer audio script, we know that the guideline was not prepared for the sports people. It was prepared for other people. So answer option A is directly the opposite. Okay, it is directly the opposite of what is mentioned over there. It is direct contradiction, an extreme contradiction, right? So therefore, we cannot choose that. But you see over here, these things are mentioned. Education, this keyword is mentioned, right? Because the guideline is basically educating people on how to identify the symptoms and how to manage it. So this is entirely mentioned. Education is mentioned, and also avoiding the concussion is mentioned. That is very clearly mentioned in the audio script. But the target audience is entirely wrong. The target audience is basically not the young sports people. That is, they're very specifically mentioning it. It is for the other people. So because of this portion not being mentioned, this cannot be the right answer. So A is eliminated, B is eliminated, and that leads to answer option C becoming the right answer, because answer option C is all about providing a range of specialist advice. Okay, coming from the neurosurgeon himself, a GP, as well as a emergency physician, right? So answer option C becomes the right answer. Right. So now before we go to the next question, let's listen to the audio once again. And this time, listen more carefully and see if you're able to find the correct answer. Right. So let's play the audio once again. Again, this much depth is extremely important. Otherwise, there is no point in doing. Again, the recorded lectures are available in the app, like very detailed slides, explanations, color-coded translations, and all that. So that definitely should help you out. So very long, lengthy lectures. It took a lot of effort from my side. It's definitely going to help you out. All right. So let's hear the audio once again.
The aim was really to provide a resource, not for the top level professional sports people, but for parents, teachers, and coaches of young people playing sport. Mm-hmm. The guidelines basically offer some expert information from a GP, an emergency physician, and myself as a neurosurgeon about what the condition is, also how to identify the symptoms and how to manage it. If any of your listeners have ever had a concussion doing sports, you'll know how frightening it can be. It's confusing and painful and difficult sometimes for teachers, parents, or whoever to work out if someone with concussion is okay. I mean, we hope to remedy that. Mm-hmm.
All right. All right. Now, so that's the answer to that. So I have prepared a document for that one. So I'll be sending that document to you towards the end of the session. So this particular question over here, what type of question is this? It is a main purpose tab question. Okay, so your duty over here is to identify what is the aim of the guideline. So it is a main purpose tab question. And here they are not assessing. So here the OET is not checking whether you know English. The OET is not checking whether you can listen English, can understand English. OET is basically testing whether you can understand the speaker's overall intention. That is, when you listen to a message, are you able to identify the reason behind the message being spoken? Okay, or the purpose of the guidelines. That is what we call as your inference skills. Okay, so I'll just type down over here. Inference. Inference basically means your ability to come to your own conclusion. That is what we call as your reasoning skills. Okay, reasoning skills. You have to develop it. These are the foundations of OET. You have to build these foundations up, right? And now, how to, so in the future, so you'll not be getting the same question in the future. So if at all, so how can you recognize this question type? Now, as you can see over here, the keywords like aim, purpose, intention, main reasons, objective, all right? So these type of words usually indicate that this is a purpose type question. Right, and so forth. So again, a mental preparation even before listening, anticipate. Okay, anticipate basically means expect. Okay, read the three answer options and expect. Okay, education, providing expert advice and clarifying misunderstanding. So anticipate broad reasoning, not tiny facts. Keep in mind that only one option, only one answer option will reflect the true overall goal. The others will basically be distractors, but it will not be the main aim. OET is extremely cunning in that manner. Okay, so again, there are certain trips over here, and listening strategies also the same thing that I have discussed, everything I have written over here. And also I have made a list of vocabulary. So some words are a little bit advanced. Now say we have concussion. Concussion basically means a brain injury or a head trauma. So you need to know these type of vocabulary over here. You need to know what guidelines are. Guidelines are basically recommendations, protocols, instructions, rules, and all. Okay, so I have made a list of the vocabulary here, and from the audio script also a list of vocabulary, and I will be sharing this document to you later on. All right, so that is the 31st question. Now let's take a look into the 32nd question. So this over here, it is not a purpose type question. So this we can say it is a cause and effect question, right? Cause and effect. So read the question. Read the 32nd question. And then I'll play you the audio. Just give me a second. So again, the app over here, in simplified terms, the explanations are there and explaining why answer option C is the correct answer. And again, the explanation is why C is the correct answer, right? And why A is wrong, why is B is wrong, like full detailed explanations are given. So you can, if at all you have doubts, you can always feel free to open the app and you can rectify it. And again, there's a reflection moment. So this type of an obedience from the student is extremely important. All right. So some students like they have practice OET in their own way. I don't force students, but if at all a student is willing to listen to my instructions, it is good for them. All right, so here let's take a look into the 32nd question. Let's have the audio script. Okay. All right, so read the 32nd question. Okay, so let's listen to the audio now. Now let's hear the audio script.
And how do we know when someone is suffering from concussion? Well, obviously, if the person's actually knocked out, it's clear. But not all patients actually lose consciousness. Often, following a hard knock to the head, they become disorientated or experience headaches, nausea, or vomiting. These are signs of concussion, and they may clear initially, but then return when the individual actually undertakes further physical activity, right, when they start to train, say. So it can actually take quite a while for things to really clear up. The essence of it is that people shouldn't start playing again until those warning signs have completely subsided.
Let's understand that in simple terms. So this is I would say medium difficulty question. So I'll just play the audio once again. The audio script.
And how do we know when someone is suffering from concussion? Well, obviously, if the person's actually knocked out, it's clear. But not all patients actually lose consciousness. Often following a hard knock to the head, they become disorientated or experience headaches, nausea, or vomiting. These are signs of concussion, and they may clear initially, but then return when the individual actually undertakes further physical activity, when they start to train, say. So it can actually take quite a while for things to really clear up. The essence of it is that people shouldn't start playing again until those warning signs have completely subsided.
Let's understand. Okay, so over here, all right. So this is a cause and effect type question, right? So what is the cause over here? Okay, Dr. Marsh makes a point that someone who has suffered a concussion. Okay, that means what is the cause over here? What is the situation over here? The patient basically has a brain injury or a head trauma. Now, your duty over here is if this situation happens, okay, what will be the outcome? Okay, what will be the outcomes? Okay, this thing has happened. What will be the outcome to this particular event? Right. So this is the cause and effect type question. Okay. So over here, the event is they have suffered a concussion. And if this has happened in the future, okay, as soon as this happened in the future, what must be done to this particular, by this particular individual? Okay. That is what the outcome is. That is what we need to find out. So let's see what is answer option A. Answer option A is telling be unconscious for varying amounts of time after the event. Okay, so if a person has suffered a concussion, the effect will be that they will be unconscious. Now, see, will basically means what? Will basically means definitely. Okay, that is, it is very definite. Okay, it will rain tomorrow. You will pass the OET examination, which means what? That is 100% certain, right? So, if a person has suffered a concussion, okay, they will be, that means it is 100% sure that they will be unconscious, okay, for varying amounts of time, maybe for 1 second, maybe for 3 weeks. Okay, so they will be unconscious for varying amounts of time after the event. The event is what? The event is basically suffering a concussion, right? So that is it. So if concussion has happened, they will be unconscious. Now, what is answer option B telling? If a person is has suffered a concussion, they will, once again, definitely they will need a medical examination. Okay, they need a medical examination before doing any further exercise. That is, it is very risky. Okay, so once a patient has had a concussion, it is very risky for them to do any further exercise before a medical examination. So therefore, they must need a medical examination before they start doing any further exercise. Right. Now let's come to answer option C. C is telling they will have to take precautions. Okay. So if they suffered a concussion, they definitely, okay, they must, okay, in the future, they will have to, that means they must take precautions. Okay. That is, they have to be very cautious to avoid the risk of symptoms recurring. Recurring basically means what? Coming back. Okay. So when the patient is having a concussion, okay, they will have some symptoms, right? But these symptoms can come back anytime soon. These symptoms can recur anytime soon. So in that situation, okay, in that situation, they need to take certain precautions. Okay, they have to be very cautious. They need to take certain precautions to avoid the symptoms coming back. Okay, so that is the thing that they need to do. Someone has suffered a concussion in the present. They definitely in the future, they need to take certain precautions. Right. So now let's do the verb analysis. Okay, let's do the verb analysis over here. So your duty over here is to identify, okay, if someone has had a concussion, what they must do. Okay, the event they have, the cause they have mentioned. Now, what is the outcome? Okay, what they must do in the future. Okay, so the outcome is they will be unconscious. So what is the action over here? Becoming unconscious, right? So they will become unconscious for varying amount of time. So this is the action over here. This is the verb over here, right? So they will become unconscious. That is what you need to make the connection to. Okay, they will become unconscious, right? Now, what is the verb? Oh, 1 second. Yeah, where are you? Yeah. What is the verb in answer option B? They will need a medical examination before doing any further exercise. Now see over here, this is one verb. Okay, doing any further exercise is one word, but also medical examination, needing a medical examination is also a verb. So there are two different verbs over here, but this is the main connection. Okay, the main connection is they will need a medical examination. Okay, so if this event has happened, then this is the outcome. They need a medical examination. So even though there are two verbs mentioned, okay, you should know which verb should be the main connection to the question, the focus of the question. Now let's take a look into answer option C. Answer option C is telling if concussion has happened, they will have to take precautions. So what is the verb over here? Taking precautions, right? They need to take precautions to avoid the risks coming from. So this is the verb over here. This is the action over here. Okay, so now see it becomes, now see very, very lengthy, long answer options. Now it has become very, very tiny. Okay, so suffers of concussion, they will be unconscious. They will need a medical examination. They will need to take precautions. Now you have to train yourself. Now when you're listening to the audio, so once you have comprehended the question like this, now when you're going to listen to the audio, okay, concussion has happened. So if this has happened, they will become unconscious. They will need a medical examination. They will have to take precautions. Now you see, this is what you need to focus on. Now when you're listening to the audio, you need to determine what could be the right answer. And definitely you need to bring in your elimination strategies as well. Right, so we have played the audio twice. So now let's take a look into the audio script over here, right? So the 30-second question. Now, once again, the trigger words. So again, there are two speakers over here. The main speaker will be the person who's giving the main message, but the other speaker is basically shaping the conversation. So a lot of trigger responses will be coming back from this second speaker. So the second speaker, that is the interviewer, is asking. Now see, it is an asking over here. So how do we know when someone is suffering from a concussion? So he's asking, okay, so if there is a patient, just by like how can we know if they are basically having a concussion or not? So every time they get a head injury, it will not be a concussion. Sometimes it will just be a small injury only. Sometimes it may become a concussion. So how can we know? How can we identify a person is suffering from concussion or not? See, that is the event. Okay, someone who has suffered a concussion. See, the second speaker is directly shaping the conversation. So they directly the main keyword is coming. Right. Now, let's see what the main speaker is saying. The main speaker is saying, well, obviously means without a doubt. Okay, without a doubt, if the person's actually knocked out. Now, this is what we call as idioms. All right. So, idioms, or we can say metaphors, or we can say figurative speech. Now, can anyone tell me what is the meaning of knocked out? What is the meaning of knocked out? If the person's actually knocked out, you can
Made,
tell.
met with an accident kind of thing, sir.
Yeah, accident has happened, knocked out. Yeah, so can you be a little bit more specific? Yeah, it is actually true, but a little bit more specificity would be better. Yeah, Dr. Abib, yeah, lose consciousness. Right. So over here, when you see, when you hear this is an idiom over here, and you have to know this. So for example, if someone, we say that person has taken too much of alcohol and he has knocked himself out. That person has taken too much of sleeping pills and he is completely knocked out. Right. So that means that person has taken too much of alcohol, or that person has taken too much of sleeping pills and they are unconscious. Right. So this is an idiom or a metaphor or figurative speech, which means these are phrases which is not reality. Okay. Knocked out basically means they are not saying the person is completely knocked out. Okay. It is basically a metaphor for saying that person has lost consciousness. Okay. So again, these are some colloquial terms. You need to familiarize yourself with these type of terms, right? So, okay, those who don't know what is the meaning of knocked out basically means becoming unconscious. Okay, it doesn't necessarily mean that an accident has happened. Right. So if the person's actually knocked out, that means the person is now completely unconscious. So if the person has become unconscious, it is clear. Okay, it clear. Now they're saying, but not all patients actually lose consciousness. Now, so saying, when you look into a patient, and if the patient had a brain injury or a head trauma, and if the patient is knocked out or the patient is unconscious, then it is very clear. It is very clear that the person is suffering from a concussion. But now he is saying, now see, this is a contrast phrase. Contrast phrase basically means what? It signals a direct change. Okay, a change in meaning is coming. Now he's saying, someone becomes unconscious, yeah, it is clear they're having concussion, but not all patients, see, not all patients actually lose consciousness. That means even though they're having concussion, even though they have a brain injury, even though they have a head trauma, even though they have a concussion, they will not lose consciousness. You see, they will not lose consciousness, which means they will be conscious. Okay, they will have their eyes opened and they know what is happening. Now, what is answer option A? Okay, answer option A is telling that if a concussion happens, they will be unconscious. Right, that is the verb over here, right? The verb over here is they will be unconscious for varying amount of time. So, but they are telling if a concussion happens, sometimes they may be unconscious, but sometimes they may be conscious. But what is answer option A telling? They will become unconscious. So that cannot be the right answer, because from the audio script, we know that even if a concussion has happened, the patients will be conscious. There is a chance that they may be conscious, right? So which means they are aware. Consciousness basically means being aware. So that awareness is there. So that means just by listening to the very first sentence, answer option A is eliminated. Right. Now it is either answer option B or it's answer option C. So you have to refine your elimination skills like this. It is extremely important because these are all multiple choice questions. Your duty is to not only choose the correct answer, but to eliminate the incorrect answer options one by one. Right. Now we have eliminated first answer option, that is A option. Now let's take a look into answer option B. Now he is saying often following a hard knock to the head. Now see, following. See, I am following a person. If I'm following a person basically means what? Someone is in front of me. Someone is in front of me and I am behind the person. Right. So following basically means first hard knock has happened. Okay. A hard knock has happened to the head. And following basically means what? The second event. Okay. So you need to know what is the meaning of following. Okay. So students, sometimes they don't know this. So this is the first event over here. A hard knock to the head. That is the first event. Okay, so I'll just type number 1 over here and see following basically means what? The second event. So after the first event, another event is going to happen. So that is what we call as the following event. On the following day, the following week, the following year. That means what? The second day, the second year, the second month, right? So the first event is a hard knock to the head. Okay, and let's see what after that what happens. See, often following a hard knock. So over here, hard knock. So this time knock basically means what? Knock means a big beating. Okay, so here knock basically means a beating to the head. That is, they got hit on the head, right? So first this happened. After that, what happened? Following a hard knock to the head, they become disoriented. Okay, now they're telling oftentimes after they get hit on the head, they become disoriented, that is, they become confused, or they experience headaches, nausea, and vomiting. Now, what are these things? Disorientations, experiencing headaches, nausea, and vomiting. What are these things? These are basically symptoms, right? So, what is answer option C? Now we have eliminated answer option A, right? Now they are talking about symptoms over here. And where did we read the symptoms? The symptoms are in answer option C, right? So now your eyesight from answer option A that you have eliminated, now they're talking about the symptoms. And symptoms we read in answer option C. Nowhere else it is mentioned. So now your eyesight should be in answer option C, right? Now symptoms recurring and they have to take precautions to avoid recurrence of symptoms. Now you have to identify whether this is what must be done by the patients in the future. Right. So now they're telling once they get a hard knock to the head, they experience symptoms such as disorientation, headaches, nausea, and vomiting. And now they're saying, say, these are signs of concussion. So still they are in the third answer option. That is the symptoms over here, right? They are signs of concussion and they may clear initially. Clear initially basically means what? It will go away. That is on its own. Okay. Initially, initial means the first stage. Okay. In the beginning, it will clear on its own. But then return when the individual actually undertakes further physical activity. Now, see, what is he talking about the symptoms? He's saying once they get hit on the head, what happens when they get hit on the head? When they get hit on the head, that is a hard knock, they will experience these type of symptoms, right? And now he is saying these symptoms, they usually clear on their own. But then he is saying it may go away. That is, it will get cleared initially, but then they will become return. Now, see, they're talking about, so very certainly they're saying, definitely it will return back. It will return when the individual undertakes further physical activity. Right. So now we have a little bit of answer option B going on. Now see, what is answer option B going on? Before doing further exercise. Right. So before doing further exercise is what they are telling over here. And that is definitely mentioned in the audio script as well. That is, if they are not, if they will experience these symptoms and it may go away. But if they do any kind of physical activity, any kind of further exercise, okay, these symptoms will recur. So now we have answer option B, that is doing further exercise being mentioned, but at the same time, the focus is also on, symptoms recurring. Right. Now, over here, we need to clarify. Now, see, over here in answer option C, precautions are mentioned. Okay, so this is the main verb over here. So your duty over here is to identify if a patient is something, they have to take precautions. And over here, the thing is, needing a medical examination. So we don't know whether these will be mentioned or not. Now, see, if answer option B is going to be the correct answer, then they have to mention they will need a medical examination. If answer option C is mentioned, they have to mention precautions to avoid is going to be mentioned. Okay, because only this part of the keywords are mentioned. Doing further exercise is mentioned. Symptoms recurring are mentioned. But medical examination is not yet mentioned. Okay, it is not yet mentioned. Precautions to avoid is not yet mentioned. So you are suspecting. Now, is it either B option or it is C option? A is definitely eliminated. Right. So over here, the connection is this one. All right. So that is needing a medical examination. Right. So now you have to be on the lookout. Okay. So B and C, both they are covering both B and C. Now, is it now precautions or medical examination? Precautions or medical examination? Like, so now you have to make the distinction. Right. So now with that in our mind, let's keep reading the audio script. So here the person is saying, when then written with the, okay, further activity, right when they start to train. Okay, so that is anytime they do any kind of activity, the symptoms will recur. Now he is saying, so now see, he is coming to his, he is coming to his point over here. So it can actually take quite a while. That means it is taking a long, it is quite a while means it'll take some time. It'll take some time for things to really clear up. So if for this patient to become entirely healed, for the patient to become fully cured, it will definitely take some time. The essence of it, that is the important point. Essence basically means the essential information. Okay, the essential information or the important information is that people should not start playing again. Okay, they should not. So the event has happened, the cause has happened, and the outcome is, okay, the event is they should not start playing again until those warning signs have completely subsided. Okay, so warning signs basically means what? Warning signs basically means the symptoms or the signs of concussion. Right. So now he is saying, so what is the speaker again? The intention of the speaker is saying, if you get a concussion, initially the symptoms will happen, but the symptoms will go away on its own. But then again, it will come back. It will come back if they do any kind of physical activity. So he's saying people should be very careful. Okay, people should be very careful that they should not simply go out and start playing again, because if they are not very careful, okay, then the symptoms will recur. So they have to be very careful and they have to wait. They have to wait until it has been completely subsided. Only then they should start doing the activities. Otherwise, the symptoms will recur. Now you see over here, when it comes to the answer options, we very easily eliminated answer option A because answer option A was talking about becoming unconscious. So that is definitely not what we are looking for. Right. Now over here, answer option B, there are two verbs needing a medical examination. That is, they definitely need a medical examination before doing any further exercise. So this over here is mentioned. Doing any further exercise is mentioned. And when it comes to answer option C, okay, the risk of symptoms recurring, that is also mentioned. Okay, that is also mentioned. Okay. Now over here between B and C, in answer option C, precautions, right? So which do you think the speaker is giving more importance? The speaker is saying symptoms can occur anytime. So therefore, they have to be very careful. They have to be very cautious and they have to wait it out. And once it has only been completely subsided, only then they should start doing any further activity or else the symptoms will recur. Right. So the more emphasis is basically on the precautions part. But what about medical examination? There is no information or they are not saying anything that if concussion happens, definitely that is 100% they have to go and take a medical examination. That is not mentioned anywhere. So since this part is not mentioned, but this part is mentioned, this part is not mentioned, B is eliminated, right? So here symptoms recurring is mentioned, and from the person we are sensing, okay, the person is basically emphasizing that symptoms can occur and therefore they have to be very careful. They should wait until it has been completely cured, only then to start doing activities. All right. So over here, the precautions, that is the emphasis over here. So this is what the cause and effect is. So if a cause has happened, that is the concussion, the effect is, that is the outcome should be in the future, they have to be extremely cautious to avoid recurring of symptoms. Right. So C will be the right answer. Right. So I will play the audio once again. Okay, before that, should I? Okay, I'll just play the audio once again and then I will take the document. Right. So first you should be able to eliminate answer option A. Then you should become, you should be locked between B and answer option C. And then you should be able to eliminate answer option B because medical examination is not mentioned, but precautions are mentioned. Right. So let's see if you're able to do it. So let me take the audio once again. Okay.
And how do we know when someone is suffering from concussion? Well, obviously, if the person's actually knocked out, it's clear. But not all patients actually lose consciousness. Often, following a hard knock to the head, they become disorientated or experience headaches, nausea, or vomiting. These are signs of concussion, and they may clear initially, but then return when the individual actually undertakes further physical activity, when they start to train, say. So it can actually take quite a while for things to really clear up. The essence of it is that people shouldn't start playing again until those warning signs have completely subsided.
Let's understand that in simple. So that is a cause and effect type question. Right. So now let's take a look into the document that I have prepared. The 32nd question. So I'll be sending this document to you later on. Oh, so sorry. Yeah. All right. So over here, what question type is this? So this is basically a cause and effect type question, right? So here it tests, again, the OET is basically testing whether you as a listener, okay, whether you as a listener are able to recognize how the speaker is linking. Okay, the speaker is linking a situation that is a cause to a consequence, that is effect over here. So how to recognize these type of question types? For example, again, these are like consequence, effect, results, leads to. Okay, so these are all about future, right? Future tense, results in, leads to, consequence, effect. So these are the words that you should be looking out for. Okay, students should be able to recognize these type of questions. Okay, and options that describe outcomes. Again, outcomes again or future based outcomes, consequences, or follow-up actions. The question is not asking what is, but what happens because of this happen. Okay, that is if concussion happens, because of concussion, what happens? right? So that distinction you should be able to make. So mental preparation before listening is that you expect the speaker to describe a situation. So they will describe a situation and then they will explain its outcome, right? So transitions. Okay. So again, there are certain transition signals, especially the word but. But is a very, very common word in OET listening. Okay. It usually signals a change in information. That is what we call as a contrast marker. All right. Contrast markers, like although, even though, these are some important words. Although, even though, whereas, on the other hand, but, these all indicate a signal change. Right. So again, I'll be sending this document over here. The strategy is basically identifying the cause, catch the effect, and also eliminate the distractors. So if finding the correct answer is tough, focus on eliminating the incorrect answer options, right? So A is unconscious, and that cannot be applied because they're saying not everyone becomes unconscious. Only some people will be unconscious. That is, some people will have consciousness. So because of that one single word, answer option A is eliminated. And answer option B is talking about medical examination, and that is never mentioned. So since that is not mentioned, but every other part of the keyword is mentioned from answer option B, that can be eliminated. So if A and B is eliminated, then obviously by default, answer option C becomes the correct answer. Right. So these are some advanced vocabulary over here. So I have made a list of that question as well. So I'll be sending this document to you. So again, the app also has very detailed slides. Here also I'm giving the slides over here. I mean the documents over here. So that definitely should help you out. Right. So that's about it. So what did we discuss in today's class? So in today's class, we discussed an interview and we discussed two types of questions, right? So we discussed a main purpose type question and we discussed a cause and effect questions. So what are main purpose type questions? Main purpose type questions, they ask you to identify the overall aim or the main reason behind what the speaker says. Cause and effect questions ask you to connect a situation to what happens as a result of it. That is cause and effect. Okay, so again, I have talked about certain tips on. So once you have identified, okay, this is a purpose type question, then this is how you have to approach. So look for these type of words: aim, purpose, intention, and all that. All right. And when it is a cause and effect type questions, look for these type of words: result, effect, consequence, and so on and forth. All right. And you will be able to. And here we had a small practice exercise as well. So like that, you can actually practice on your own. All right. So listening and reading, take printouts from the Cambridge materials that we have shared, practice it. Go through once you have practiced all the 42 questions, again, build foundations first. Don't have too much high expectations. That is, yeah, from day one itself, I must get 42 out of 42. Right. So you must be very comfortable making mistakes. You have to be very honest with yourself, identify what your strengths are, identify what your weaknesses are, make a list of it, right? And then go to the recorded lectures from the app and go through the questions that you made a mistake. So from there, you will be getting a lot of information, right? And with that understanding, you implement all these strategies that I'm giving you over here, and slowly. That is, it's going to be a very slow and a gradual process, right? Only then it will be sustainable in the long term. And always have, a very enthusiastic attitude when you're practicing the OET. If you see the OET as an enemy, if you see the OET as a burden, if you see the OET as a exam that you just have to take for the sake of it, and if there is no enjoyment when it comes to practicing the OET, it is not going to be a pleasant experience. You must really have that enjoyment factor with you. So that is why I go into too much effort to make the classes as, fun as possible, and at the same time as productive as possible as well. Right. So I'll be sharing these documents to you towards the end of the session, and also I'll be sharing the recorded class lecture as well. So if you want, you can review to the recorded lectures.